Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
Welcome to the Psychology Club podcast. Today we are talking with Lydia, a school psychologist with Martinez Unified School District. Welcome.
Thank you.
And I'm Michaela. What kinds of anxiety do most teens often experience?
I would say the most common kind of anxiety that we see is just generalized anxiety disorder. But some other types that we see in teenagers but aren't as common are like social anxiety. You can have panic disorders, phobias of various things. I see a lot of like school refusal, which kind of stems from anxiety. And then also kind of less common are like PTSD, post-traumatic stress disorder, obsessive compulsive disorder, and selective mutism are all obviously less common. But generalized anxiety disorder is probably the most common we see. Yeah.
Nice. Well, not nice, but
yeah.
So my name is Lydia, and what usually causes anxiety, and how common is it among young people?
Yeah, so I have a little visual that maybe we can work into the video. So anxiety starts right in these two little almond-shaped things in your brain called the amygdala. And the amygdala is your it helps regulate your fear responses, and it's like your body's alarm system. So it kind of triggers the fight or flight response. So think of like the big example I like to give is if you're in the woods and you see a bear, you're going to immediately go into like, okay, what do I need to do? I need to get out of this situation. And it spikes your anxiety. But that's essentially what happens when you're afraid to speak in front of a class. You're afraid to go into a classroom. You're afraid to go to school. You're afraid to see somebody. And so what happens is then once that system is triggered, your blood sugar increases, your pupils dilate, you sweat. Your heart rate increases. I know that's a common symptom for a lot of people with anxiety is the like pounding heart. Your muscles tense, but it all stems from that amygdala that's just basically like something's wrong, you're not safe, we got to get you out of the situation. Yeah.
Well, let's get information.
Yeah, it's the biology of it. Yeah.
My name is Kaylee. In what ways can anxiety affect someone's daily life?
In a lot of ways, it can affect your memory, your focus, your ability to follow through with tasks, your motivation. Like a lot of times we see kids with anxiety that like don't want to get out of bed in the morning because they're feeling so stressed. It'll, even in class or when you're at work, like you might have a hard time like keeping track of what you're doing, remembering what you're doing, remembering things if you've ever like been in a situation where like you're in class and your teacher's talking and you've got to test the next period and you're just not focused on what your teacher's saying because you're worried about the test. So, it can affect it in a lot of ways. Yeah.
Hi, I'm Gabby. How long do teens typically deal with anxiety? Does it usually continue into adulthood?
So, good question. And so some have dealt with it for years. We see it a lot in like little kids, especially if you've got like a post-traumatic stress disorder case. So it can kind of start early and happen, but a lot of times, especially like in the teen years and even in like middle school, we see anxiety just kind of starts to crop up. Life gets harder, social situations get more complicated. So it's, your anxiety starts to crop up, and then without any kind of intervention, it can go into adulthood. We've seen it where you don't do anything for it, and so then it just gets worse and worse and worse and worse. There are things like medication, therapy, calming strategies that you can do. And, could it go into adulthood and always kind of impact you? Yes, but there are also ways to manage it and kind of keep it low. Yeah.
Yeah. Thank you.
Yeah.
What are some signs that someone might be having a panic attack or an anxiety attack?
Yeah, so panic attack is kind of that's the big one, is like they might be having hard time breathing, shortness of breath, they might be sweating. Sometimes you'll see they might even, because of the shortness of breath, they might pass out. Can even go as far as like nausea, vomiting, trembling, shaking. So it's, you just see somebody that's like, they might be like totally white in the face because the blood is totally drained from their face. But I think the biggest one is the shortness of breath and the kind of a hard time breathing.
Mm-hmm.
Yeah.
Okay. How can anxiety affect things like school, attendance, grades, and focus?
It can impact those and affect them pretty intensely. So if you have a student, like especially if they're untreated, we can, if your anxiety is so high that you're not wanting to come to school, then your grades and your attendance are going to be bad. It can impact your focus in class if you are coming to school. It can affect all of those ways pretty intensely, especially if untreated. And like I said earlier, is it can be something that's always kind of there, but you can manage it. But if you're not getting treatment for it, it can be pretty all-encompassing.
Yeah.
What are some healthy ways to cope with anxiety and stress?
That's a great question. So I've got a couple of examples that maybe we can go over. So there's like different breathing techniques to get your breathing regulated. And then some of the, outside of therapy and medication, because I think those are great, but also not for everybody and are more intense. But, things like talking to a friend. I've seen so many students who just want to try to manage their symptoms and their problems by themselves. And I think we are a social species. That is not something that's going to be productive. So like talking to a friend, talking to, like, for teenagers, an adult in your life, getting outside, getting some exercise, going for a walk, and then even just simple things like watching your favorite movie or TV show or listening to some music that makes you feel good. I mean, I keep seeing this thing about, people rewatch shows or movies because it's something that's known to them and it's something that's comfortable and they like, and so things like that can help kind of calm your anxiety. And so it's all about finding, strategies that work in the moment. So when you're in the middle of class, you can't just like pop on your favorite TV show. So it's like, what are you going to do when you're in class versus like when you're at home? And coming up with some just like a little toolbox of ways that you can manage your anxiety in the moment. Yeah.
Could you walk us through or show us one technique that helps calm anxiety?
Yeah, absolutely. So this one I particularly love. So I have two. I could do two. We'll do two. Okay, so the first one is box breathing. So you basically are just imagining like breathing in and out in a box. So you're going to inhale for 5 seconds. You're going to hold for 5 seconds. You're going to exhale for 5 seconds. You're going to hold for 5 seconds. Inhale for 5 seconds. Hold for 5 seconds. Exhale for 5 seconds. Hold for 5 seconds. So that's one that I like, is just really focusing on your breathing, because as we were talking about with like a panic attack, is you do the like the really like short, shallow breaths, which is not getting any air to your brain or any blood to your brain. And so making sure you're focusing on like breathing in, holding, breathing out, holding, and kind of going through a pattern and doing that for a minute, 2 minutes, kind of as long as you need to regulate your breathing. Another one I like, and this is called the 5-4-3-2-1 grounding technique. Okay, so first, we're all just going to kind of, except for me talking, sit quietly. Think of 5 things that you can see. Right now, in this moment, what are 5 things you can see?
I can see the red expo marker.
Well, yeah, and even just think it.
Oh.
Yeah, just think it. No, that was good. But think 5 things that you can see. Maybe give me a thumbs up when you're... Okay, so now think of 4 things that you can touch even kind of in your immediate vicinity, what are 4 things you can touch? And it can be like the chair, the table, the ring on your finger, your hair, like things you can touch. And then we're going to think of 3 things you can hear. Okay, now what are 2 things you can smell? And then the last one, which I always think is so funny, is 1 thing you can taste. What is something you can taste? And it could be your coffee from this morning, or remnants of your breakfast. So those are 2 strategies that I really like. And both of them are things that you can do in the middle of a class when things are going on around you. Nobody needs to know that you are, going through the 5, 4, 3, 2, 1 list or doing some breathing. Sometimes it's even like I gotta step out of class and do my breathing technique. But those are 2 that are really helpful kind of in the moment wherever you are, whether it's in a crowded grocery store or at home by yourself in class with a bunch of people.
What is one coping strategy you personally use to manage stress and anxiety?
That's a good one. I definitely try to work on my breathing, and I have to say I'm not as... I need to work on it more. So here I am being somebody who's admitting that they need to work on something a little bit more. So definitely the breathing and like focusing on your breath, because your breath is like the, end all be all for your life. Like you need it. You need to breathe to be able to live. So focusing on your breath is a great way. Yeah. And I mean, I'm a big fan of talking to friends and sending a quick text message and, oh my God, I'm freaking out about this. And maybe they've gone through that trying to find somebody who's gone through a problem similar to what you're having and getting their input on it is great. Yeah. Yeah.
Thank you, Lydia, for joining us today. We learned so much about anxiety and how to cope. Thank you all for watching. Don't forget to like and subscribe for more great mental health content.
Thank you.